Okay, thank you. EIB is a very strong presence together with the World Bank Group and EBRD, one of the three main financing entities in Ukraine during the war. And we have contributed up to 1.7 billion to date in projects in Ukraine. We also had the largest ever donation that the EIB Institute, which is the foundation of the EIB, has ever done in the history of their operations. And this is again to Ukraine. And then when we come to the real numbers, I just want to highlight here, you have the slides and they can be shared. And it's something that I want to highlight, that most of our activities are carried out under EU mandates. So it's always a Team Europe effort because the European Union, the Commission are guaranteeing the mandates under which we operate in Ukraine. There is also a significant technical assistance contribution, either directly from the European Union or through the EIB, together with grants. As I said, together with our colleagues from EBRD and the World Bank Group, we contributed to almost 7 billion euros to the reconstruction efforts. What I want to highlight on this slide is the share of our EIB investments in several sectors, and the health particularly goes under municipal and environment, and support to SMEs is also something that has to do with our life sciences activities. Again, the numbers are significant, but we think there is room for much more, and for sure there is a desperate need for much more. Two examples: the Ukraine Early Recovery Program, which is a multi-sector framework loan of 200 million, targeting early recovery reinvestments on critical infrastructure. This is going on since 2014, starting with an implementation in 2015, and it's still ongoing. The beneficiaries are the central state executive bodies, local administrations, local self-governments, state municipal enterprises. So it's entirely dedicated to the public sector, but through their different entities. I have a few examples of this, and okay. And again, you will have the slides, so you'll have the slides so you can read the details. I just want to point out that even though it's presented as municipalities, 26% of these funds had been used for reconstruction in healthcare, which is the sector we're talking about today. I'm really trying my best. Again, several results of this project. I maybe don't touch it. 32 hospitals and healthcare centers, and then 45 schools, kindergartens, residential buildings, and so on, that had been rehabilitated or reconstructed with the support of this program, with the support not just by this program. But then I just want to highlight that in total, 76 of these facilities have been damaged with high I really did not touch it. It's probably the timing. Somebody's telling me that I'm behind. Yeah, the thing that I want to highlight is, even though some of this had been completely destroyed, partially destroyed, or just affected, we will continue to support with this program as it was planned, and as we will adapt it to the local reality and the local needs. What I have on the slide is from a draft strategy that is being prepared by the Ukrainian government. I hope they can confirm that this is the case. We receive it as part of the donors group for comments. I think we all agreed, at least the comments I've seen to now, that is very much to the point. It has everything it needs. And I just highlighted on the slide 2 operational objectives that can highly benefit from the contribution of the EIB in the future, because the developing and supporting of the healthcare areas related to new challenges and special needs, it's the entire part of the reconstruction, building of facilities, introduction of new models of care and their corresponding facilities. So the entire infrastructure component, but then strengthening the capacity of the health system to respond to challenges, global threats, and to effectively manage emergencies is something that we're very much interested into, and we take guidance from the World Health Organization and other partners that have significant work in this area, and we stay ready to finance, co-finance, and make our resources available. The point I'm trying to make with the slide is that we respond to the needs in the country. We try to make sure that our investments are aligned with the strategic priorities of the country. And of course, we take policy guidance from the European Union, which is our founding mother and father. Coming back to who I represent here, the Life Sciences and Health Division, really, at the European Investment Bank. This is what our division was supporting and contributing to since we started our activities. And you can see that is more than 5 billion for the last 3 years that we invested in health and life sciences projects. Of course, not all of them in Ukraine, as we know, but that gives you an idea about our experience and reach with our projects. And also you can see that the years where we had the most intense activity is 2010 and then 2020 to 2022, which are usually the years right after or at the end of significant crisis. We remember the financial crisis, we remember COVID, we now have the war. So that's where our institution and instruments are best placed to respond to the respective needs. I just highlight the principles of EIB financing for projects in the area of one side health, what we call health, which is mostly the infrastructure part, healthcare delivery, and life sciences with the research, biotech, pharma part that we usually do with the private sector. You will see that they are aligned with if I can summarize the SDGs, and then subsequently with all other relevant international policies. It's nothing special. We just reflect them also in our work like every other institution. So equity of access, it's critical, economically viable, sustainable, and based on best practices and scientific evidence, consistent with the relevant strategies and policies, embedded into national, regional, and local strategies and action plans, and strictly following the respective environmental and procurement laws. We're also, the EIB is the climate bank, so whatever we do, we want to make sure that our projects contribute to climate action. If we look at the life sciences side, our projects have high economic value add. They're increasing the quality of life of patients. They maintain and increase highly skilled jobs in the companies that we support, ensure the creation of European IP, and provide insights into diseases that need to be addressed, either because of the nature of the disease affecting either being a significant cause for mortality and morbidity, or on the contrary, being one of the diseases that are rarely addressed due to the lack of potential financial returns. Either it goes too fast or it doesn't go. Okay, I'll continue from here. Maybe it has a life of its own that I'm not familiar with. So, yeah, thank you. So the EIB support to the health sector, coming back to apart from the principles, how do they translate in project? What type of projects do we support? So, yes, thank you. No, too much, a bit too much. Yeah, thank you. The infrastructure is the main part of the activity of the EIB, with primary health care, hospitals, integrated and long-term care, any type of facilities, equipment that are infrastructure for the delivery of the health care. Innovation, medical research and structural changes in the way health is delivered and financed, medical research, medical education and training, digitalization and e-health, and recently vaccines and vaccination campaigns. For some of you that you ever encountered our projects, you see that we're doing more and more in the training and vaccines and vaccination campaigns area. And this is mostly a lesson learned from the COVID pandemic and responding also to the acute health workforce crisis that we're encountering globally and particularly in Europe. Our health projects are accompanied by technical assistance in certain cases, and I would imagine that that will always be the case for projects in Ukraine. May be supported in the form of individual loans, framework loans, programs, different type of financial instruments that we can put, together when we talk about these projects. For example, for the research and development part of the life sciences, we have venture debt, we have other type of financial instruments. Classical procurement, but also PPP structures are possible. We work with both public and private promoters, of course, but we serve the general population. When I say serve the general population, we're coming back to the equity of access issue. So we aim that our projects have a significant contribution of care into the public sector, no matter if they're operated public or privately. Thank you. Next. Yeah, yeah, it's just to make the same points about the research and development projects that we support in the life sciences. RDI, technology transfer, industrial scale up, they are all contributing to drug development, to epidemic issues in the infectious diseases area, being diagnostic or treatments, novel medical devices or innovative diagnostic tools. So most of our partners in this area are private companies, and we usually offer our project support to the companies in the late stage clinical trials, for example. That's the window where it's very difficult for them to raise financing without diluting the company. Next, please. Thank you very much. I have some links for you here on the slide, so you can use to look at our other activities in health. And happy to take any questions you might have. If we go to the next slide, you also have my contact details, and here or by email, I'm available to take any questions you might have. And again, as far as we're concerned, this presentation can be distributed to the participants. So yeah, thank you very much.
In the healthcare space, we have mobilized about 9 billion of financing in the past 2 decades, pretty evenly distributed across all of IFC, all of the global, all of the continents, basically. And what we consider healthcare sector, it spans across the value chain, basically covering the health services and medical education, medtech, medical device sectors, both manufacturing and distribution, as well as pharmaceutical life sciences sectors. And we are also pretty evenly dispersed around all of these sectors. We have close to a 4 billion portfolio across the world. We can just take it off, actually,
No,
because this is not the presentation that I shared. That's okay. Because like I said, I will spend a little less time on IFC. I'm happy to share more information for you on what we do. One of the last things maybe I would mention is we talk a lot about the investments that we mobilize and do in the sector. But what we've learned over the past 2 decades is it's not really lack of financing. It's a lack of bankable projects that has been our main issue, main challenge. So we launched a number of platforms over the past few years trying to enable these bankable, or in some cases co-create these bankable projects. So we've launched platforms to help health service companies with their quality services, their benchmarking across different peers, and also we've launched our ethical principles for health service providers. On the digital transformation, we have DigiHealth and DigiPharma platforms to help companies strategize their digital transformation, implement and finance these. Similarly, in resource efficiency, climate change, and green buildings, we've been helping a number of our clients expand their operations. So, and one of the things that we've launched in the last 3-4 years, what we call our upstream business, we've been working with companies to co-create projects, and this has been quite helpful for us in working with our strategic clients who would like to expand to different countries, different sectors. So in the case of today's discussion, we are looking forward to working with companies to co-develop bankable projects in Ukraine. So if I may speak a little bit about what do we see, the challenges and opportunities in Ukraine. And many of you in the room actually know a lot more about this, so I'd love to have conversations with you in the afternoon. But what we've been, even prior to the current challenges, Ukraine had one of the worst health outcomes in the region. Although it actually, when you look at the healthcare capacities in terms of the infrastructure, it actually has more beds per capita than many of its peers, but the hospital infrastructure had been outdated, many of which unable to be used. So during the recent conflicts, about 16% of the public hospital infrastructure have been damaged. This is, I think, corresponds to around 1.5 billion of damage and $12 billion of losses. Whereas the private sector plays actually a limited role in Ukraine. I mean, on the health services side, it's been a very fragmented sector and facing quite a few regulatory and governance challenges. Pharma sector in Ukraine have been actually one of the largest 10 compared to the Central and Eastern Europe, and it's been identified as the top 10 most attractive industries. It has not integrated vertically, so there is still a lot of dependence on exports, including APIs, which I'm pretty sure a lot of which comes from Italy. And this has been a main challenge in Ukraine, especially with the global disruptions that we have faced during the pandemic and following which Russian invasion of Ukraine. So those are, and human capital, of course, has been a main challenge for us in investing across the health value chain. The brain drain has been a major issue, with many of the doctors leaving the country and also inability to train according to the needs of the industries. So those are the challenges that we see actually across the world as we work with the emerging markets. But what we have also seen, especially during the pandemic, is that some of these challenges presented opportunities for emerging markets to even leapfrog in some areas. So Dana talked about vaccines. We've been working a lot actually with EIB in terms of creating new vaccine technologies and facilities in emerging markets. We've been working on localizing of production, both in terms of pharmaceutical products as well as medical consumables and more complex medical products. And we also have seen quite a bit of innovation happening in emerging markets to basically address the major challenges that we have seen during the pandemic. So we talked about the public infrastructure. We think public-private partnerships, when appropriately develop can be a way to resolve part of these issues. I mean, you might be more familiar with the Turkish hospital PPP program, which actually revamped about 25% of the existing public infrastructure in the country. So that's one of the things that we had been working in Ukraine quite actively, and I'm hoping it can be revamped. Again, there are actually quite strong pharmaceutical companies in Ukraine, and right now the global supply chain, global manufacturing landscape is being reshaped with more onshoring and localization of production. So we are working with many countries, and I'm hoping the same for Ukraine, for its reconstruction and rebuilding, in terms of seeing what could they competitively achieve in positioning themselves as part of the global value chains. What can be produced in Ukraine, and and we're also seeing regional manufacturing hubs being developed in countries like Poland, similarly Romania. And we would like to see all of the countries basically positioning themselves within these regionally developed manufacturing facilities. So IFC actually never stopped its operations in Ukraine, and we have recently launched our 2 billion economic resilience action plan. We would like healthcare to be a major priority for Ukraine's reconstruction, to address both the vulnerabilities that have been existing for the past decades in the country, and also the damages that was caused in the past few years. And for that, we see around 4 pillars where we can work actively to develop projects and also to create the enabling environment. So I talked about strategic prioritization of healthcare, and Ukraine has launched a very comprehensive healthcare reform program in 2018 that actually did include some of the responses to the challenges that I mentioned in terms of the regulatory and governance issues in creating a level playing field for the private sector. And secondly, I talked about the public-private partnership. We believe that starts with a very strong dialogue between public and private. And this is not only about building infrastructure. I think when we talk about PPPs, a lot of us think about the large hospital projects, but there are actually a lot of very innovative PPP structures in other parts of the world in terms of enabling the public sector to better leverage private sector capacities, such as in rehabilitation, diagnostics, and similarly in other parts of health services. Thirdly, I mentioned regionalization of manufacturing. Again, it's important to see how Ukraine can reposition itself in terms across the value chain, in terms of how we can have some of the production located in Ukraine and helping the current production capacities. And finally, we need to have partnerships in place to expand access to human capital. And I'm pretty sure a lot of you have projects in mind on how we can help Ukraine, not only through investments, but also through bringing in the much needed technology and human capital transfer through these partnerships. And all of these hopefully will be supported by a very strong investments. We see a very strong global community support that will enable blended finance, concessional finance to de-risk private investment and create those sustainable projects that we have been missing in addressing these challenges. So let me stop there before you do. Thank you very much for your time.
Thank you.
My name is Thomas Kergal. I am in charge of the assessment and monitoring of the health portfolio at the bank within the technical directorate. And so I'll be presenting this morning for some of you who may know the bank already. I will summarize our activities. Do I push the next? Yes. So next, please.
We don't
know how this.
We need that.
Maybe you need to get closer to the. So the monitor. Thanks. So the CEB was actually created 65 years ago. We have a very special, unique mandate compared to my colleagues here who represent IFC and EIB. We're really the social bank of Europe, and we work within our 42 member states. They span from Baltic states to Portugal, from Georgia, Turkey, Moldova to Ireland, but we don't work outside the member states yet. Ukraine is actually on its way to a membership, and we hope to be working in Ukraine very soon. As our colleagues, we're using flexible financing instruments with diverse clients. This could be at government level, at regional level, and we really try to have tailor-made financing solutions and provide also technical expertise throughout the project cycle. We work in partnership, not with IFC yet, but with the EIB. We have common projects. I can mention Croatia, the Rijeka hospital, where we co-finance the development program in Rijeka, and always trying to find synergies together to deliver higher social impact on those projects. Next, please. And of course, we look at delivering a strong commitment to our project. Just in a snapshot, last year we have approved more than 4 billion euros of loans across 36 projects targeting 16 countries, and actually 1/3 of that was to support activities of our member states in their efforts to host people fleeing the Russian aggression in Ukraine. In terms of completion and impact, we completed 22 projects to finance new social infrastructure, benefiting almost 6 million people and creating 100,000 jobs overall. Next, please. So when it comes to the projects that we deliver, we focus on 6 main sectors of operation: health and social care, social housing, education, urban development, support in MSME financing and microfinance. And across those projects, we always have a particular focus on 3 cross-cutting themes, including climate change, gender equality, and digitalization. Next, please. So when it comes to health, we carry out our projects along 4 priorities that were developed a couple of years ago and that are similar to what our colleagues here are looking after. Basically, delivering high quality, affordable healthcare infrastructure, addressing unequal access, aging population, NCDs, and climate related health impacts. Pushing for projects that are integrated, that have an integrated approach to healthcare needs, including migrant and refugees, and putting a particular focus on women's health and the benefits of the care economy for women's economic empowerment. Next, please. In terms of volumes, if you look at the numbers, you can see that in 2020, we approved almost half of our loans in the health sector. That was due to the COVID pandemic, of course, almost 3 billion euros. That was a very, very active year, as for everybody in the room, I guess. And we're coming back to more regular numbers, around 20% in 21 and in 22. What I'd like to give you details on is our experience in our member states and in our target countries. We work, for instance, on supporting Estonia, Bosnia, on mental health projects, either at the primary care level or at the hospital level. We work in Turkey and Bosnia on strengthening primary health care. We work on developing a hospital infrastructure in Moldova, in Balt. We do this with the IB, in fact. We do Balt, and they will hopefully do Cahul in the south. We work with the Bucharest municipality to build a general hospital. These are in the pipeline. We do have a project that is confirmed in Hamburg, in Madeira. I mentioned Rijeka. We also work in Spain, in Santiago de Compostela, on Pontevedra and Montecelo. We do this with the IB as well, and we're financing the hospital, the children's hospital, Tiršova Hospital in Belgrade, in Serbia. We also have projects that are really trying to support the integration of care, and this can go from infrastructure to equipment. For instance, in Moldova, we have a small but quite impactful project financing ambulances to improve the system of emergency services. We support through our budget support instrument. We support the reconstruction, refurbishment, rehabilitation of the Serbian healthcare hospital care system and social care system through budget support. We do so in Slovakia, in Spain, and as I said, we do social care that is supporting the infrastructure in developing care for the elderly, retiring home, medicalized home, infrastructure for people with disabilities, as well as for persons victims of gender violence. And we do this either through budget support to our clients or through financial intermediaries that then lend to smaller clients. Next, please. So when it comes to Ukraine, as I said, Ukraine has applied for CB membership last year, and we hope this will be completed very soon. And while waiting for this accession, we have been supporting our member states in taking care of refugees fleeing the country and their host communities. We impact about 2 million people receiving aid from the bank, either through loans or grants. We are, for instance, working with the IOM, the International Organization for Migration, on points of entry along the borders. I was in Uzhgorod last week looking at the activities that have been developed by IOM. Very good work between Uzhgorod and Košice in Slovakia. In the strategic framework of the bank, one of the three main objectives is in fact very clearly stated that the bank is aiming at supporting the reconstruction of Ukraine between today and 2027, with increasing involvement starting from 200 million euros per year to 400 million within 5 years. We will be focusing on the health sector. Our mandate is really to reach out to the most vulnerable people, and this is where the CB can bring its highest value. Next, please. So in the health sector, we've been actually meeting with your colleagues from the Ministry of Health almost 2 months ago in Rzeszów in Poland, working with them on the different lines of action that could be of mutual interest, including mental health, primary health care, hospital modernization and reconstruction, capacity building and digitalization. We talked with the minister and the head of the hospital directorate on trying to see how to cooperate together and see where the needs were. It's a hard job, as you know, because assessing the needs, assessing what needs to be prioritized when things are destroyed and the local communities actually need access to medical services is a big challenge. Just to finish, beyond health, we are also looking at other engagements, in particular in the housing sector, where the needs are also pressing, and we are trying to bring our experience in and our expertise in post-conflict settings in Europe. So I will stop here. I'll tell my Ukrainian colleagues, Slava Ukraini.